Hi, we are Joshua and Maria Fernanda, and we will talk about the COVID-19 pandemic and all aspects about this disease. Well, as we know, humanity has always suffered and gone through many epidemics and pandemics caused by different viruses and bacteria. The new coronavirus is no exception. This is a severe acute respiratory syndrome. Coronavirus 2 is a newly identified virus that differs from severe acute respiratory syndrome coronavirus and Middle East respiratory syndrome coronavirus, but can cause similar symptomatology associated with pneumonia. This viral disease was named COVID-19 by the World Health Organization and was first recognized in Wuhan, Hubei province in China in December 2019 and may originate from eating wildlife. After its introduction in Thailand, the virus has spread to more than 200 countries and territories. The World Health Organization declared this disease to be a public health emergency of international concern characterized as a pandemic.
Well, the next point I will talk about of the etiology. In 2019, a new coronavirus was identified as the cause of a disease outbreak that originated in China. The virus is now severe acute respiratory syndrome, coronavirus 2. This is cause is called coronavirus COVID-19. In March 2020, the World Health Organization declared the COVID-19 outbreak and pandemic.
And then the next point is about the pathophysiology of COVID-19. But to understand these mechanisms of SARS-CoV-2 is very important to describe the viral structure, the genome, and the replication cycle. COVs are positive stranded RNA viruses with a nucleocapsid and envelope. A SARS-CoV-2 virion is approximately 50 to 200 nanometers in diameter and has a positive ssRNA genome of approximately 29.9 kb in length. The virion has 4 structural proteins known as the S of spike, E of envelope, M of membrane, and N of nucleocapsid. The N proteins hold the RNA genome, and S, E, and M proteins together create the viral envelope. The spike glycoprotein S facilitates the virus attachment to the angiotensin converting enzyme 2 receptor and fuses with the membrane of the host cell. SARS-CoV-2 then uses serine proteases TMPRSS2 for S protein priming, infecting the target cells. The spike proteins of SARS-CoV-2 contains 2 subunits that are subunit S1, receptor binding subunit, and subunit S2, that is fusion subunit, to mediate the viral binding to receptor protein and initiate membrane fusion. The S1 and S2 subunits are divided by the S cleavage site. To facilitate viral attachment to receptor and fused with cell's membrane, the spike proteins need to be cleaved by cellular proteases from the S1-S2 cleavage site. The molecular analysis of S proteins identified an insertion at S1-S2 site, which is absent in other SARS-CoV. The viral RNA hijacks the host cell's machinery to initiate the viral genome replication and polypeptide chain synthesis and form the replication transcription complex needed to synthesize the subgenomic RNAs as well as the structural proteins.
The epidemiology. The first case of COVID-19 was detected in Mexico on February 27, 2020. 64 days after the first diagnostic case, the number of cases increased rapidly following an exponential growth trend. The total number of COVID-19 cases in Mexico is 19,224, including 1,859 deaths of April 30, 2020. On April 2020, rigorous efforts have been made worldwide to contain the virus through mandatory quarantine in some countries. To date, 4 months after the appearance of the virus, there are 3,019,445 laboratory confirmed cases of COVID-19 and more than 270,769 deaths worldwide. For this reason, the rapid growth in the number of infections worldwide is of great concern.
And now I'm gonna talk to you about the symptoms of this disease. And it's important to say that there is no specific clinical symptom that allows COVID-19 to be reliably differentiated from other viral respiratory infections. However, some patients with mild symptoms at the beginning may progress to more severe symptoms after a week. While most infected individuals have mild symptoms, pneumonia, multiple organ failure, and death might be seen in some cases. The most frequently reported symptoms are fever, cough, myalgia, fatigue, dyspnea, and less often headache, diarrhea, and runny nose. The most common symptoms were cough in 56.6%, weakness like cough in 56.6%, taste disorder in 35.7%, myalgia in 34.3%, and fever with the 33.6%. The most common symptoms, most common of these are weakness and cough. Smell disorder, taste disorder, and diarrhea were significantly higher. The virus may have become more enterotropic within this period. SARS-CoV-2 virus RNA can be detected in the cerebrospinal fluid. Virus has the neuroinvasive potential. The most common complaints in patients of nervous system involvement were taste and smell disorder.
In the clinical manifestation, it was found that the SARS-CoV-2 virus produced COVID-19 disease, whose most severe manifestation is pneumonia manifested by fever, cough, dyspnea, and bilateral pulmonary opacity on chest X-ray.
And for diagnostic disease, RT-PCR is a test that uses nasal swab, tracheal aspirate, or bronchoalveolar lavage specimens. The primary and preferred method for diagnosis is the collection of upper respiratory samples via nasopharyngeal and oropharyngeal swabs. The specificity of RT-PCR seems to be very high, although there may be false positive results due to swab contamination, especially in asymptomatic patients. And in the radiological findings, we have the typical CT findings in individuals with COVID-19, where ground glass opacity, particularly on peripheral and lower lobes, and bilateral multiple lobular and subsegmental areas of consolidation, especially in ICU patients.
Treatment. The one medicament is Paxlovid antiviral should be taken by adults, children 12 years of age and older. As soon as possible, should be started within 5 days of the symptom onset. It is taken at home by month. Two medicament is Becluri, is an adult and children. Taken as soon as possible should be started within 7 days of symptom onset. Taking an intravenous and infusions in an hair care setting for 3 consecutive days. The Hebrew for adult only administered as soon as possible should be started within 5 days of symptom onset. Is taken at home by month. Some treatment may have side effects or interaction with other medicaments you take. Now, if you are hospitalized, your healthcare provider might also use other types of treatment depending on the severity of your conditions. Most people with COVID-19 have the mild form of the disease can recover at home. The COVID-19 vaccines are effective in protecting people from the severe form of disease, hospitalization, and death. Specifically, is the revised booster dose.
And finally, in conclusion, the new coronavirus, also known as COVID-19, is an infectious disease that can cause pneumonia and other respiratory symptoms. The virus originated in China December 2019 has spread rapidly globally, prompting the World Health Organization to declare a pandemic in March 2020. Although most infected people experience mild symptoms, some patients can develop severe pneumonia or even die. Currently, there are several treatment options available, including antiviral medications and supportive therapies. And the best prevention remains to stay vaccinated and follow CDC recommended safety guidelines. And that's it. That's all of our part. And thank you for paying attention. Goodbye.